According to the DC Health Department, over 12,000 residents in the District of Columbia are living with HIV, or the human immunodeficiency virus, which attacks the body's immune system. The national nonprofit HealthHIV advances effective prevention, care, support, and health equity for people living with or at risk of HIV, AIDS, and hepatitis C. Welcome to Impact Moment, brought to you by DCTV. I'm Rebecca Burnett, and here to break down HealthHIV's mission is the organization's Director of Communications and Content Strategy, Matthew Pryor. Welcome to the program.
Thank you for having me, Rebecca.
Before the COVID-19 pandemic began, of course, you guys were created before then. You've adjusted your strategies to address what you guys call the syndemic that's affecting underserved populations now that they're dealing with both HIV and COVID-19. What is a syndemic, and how have you kind of had to adjust your strategies to help people?
Sure. So a syndemic is a co-occurring epidemic. So we see syndemics of HIV, STIs, hepatitis C, the opioid epidemic. And we've made it a real point to try to focus on the syndemic approach, meaning that we recognize that there are forces that underlie and drive all of these epidemics. And that's, socio-demographic information, like how much you make, what color your skin is, where you live, what kind of access you have to healthcare, all of these things that drive all of these epidemics and that are shared by all of these epidemics.
And how are underserved populations disproportionately affected by HIV?
Sure. So underserved populations kind of bear the brunt of these epidemics, especially the HIV epidemic. Research and data continues to show that those people who are poor, or those people who are of a racial or ethnic minority community are at a much higher risk of acquiring HIV, and that also at a much higher risk of having really negative side effects and health outcomes from having an HIV diagnosis. So, it really boils down to the systems that are in place for access to healthcare for these people, whether that's access to insurance so they can see a doctor, or it's access to high quality healthcare, or racism that's kind of built into these systems that were built like a long time ago, and that are not really built for especially communities of color.
And I would imagine that your annual conference, Synchronicity, kind of brings this to attention. You have a long list of things that you cover. HIV, hepatitis C, sexually transmitted infections, LGBTQ plus health, health equity. That's a lot of different topics. What is the goal of your conference?
Sure. The goal is pretty simple. It's a recognition that there are forces that drive all of these epidemics, and that if we were to, we can't end one epidemic on the back of another epidemic, meaning if we have any hope of ending the HIV epidemic, which has been identified as a goal of both the previous presidential administration and this current presidential administration, then we also have to address the syndemics of STIs, hepatitis, opioid epidemic, and we really need to be promoting LGBTQ health and health for racial and ethnic minority populations.
So if anyone wants to learn about your next conference or just check in on what you're up to these days, what's your website and what's your social media?
Our organization's website is healthhiv.org, and the same thing for social media. So please check us out. All
right. Well, thank you so much for joining me today. I appreciate it.
Sure. Thanks for having me. I really appreciate your interest in this.
And thank you to our viewers at home for tuning in to this episode of Impact Moment. It's part of DCTV's nonprofit capacity building grants program, bringing meaningful media to the DMV's nonprofits that are making a difference. Find out more at dctv.org/grants and stay up to date with our latest productions on our live stream at dctv.org/live.